Today's program is dealing with dairy lameness, and we're delighted to have two of the preeminent folks who work with that topic every day. To start our program, we've got Dr. Phillip Jardon. He graduated from Iowa State College of Veterinary Medicine and completed his MPVM and Dairy Production Medicine residency at UC Davis. He's been in private practice in industry for 35 years, and he has got a particular interest in transition cow diseases. He's currently Dairy Extension Veterinary at Iowa State University. Dr. Jardon, as I always say, the podium is yours.
All right. Well, thank you, Fred. Before we start, can you confirm that you can see my screen well?
Absolutely.
And you can hear me?
Yep.
Very good. So we'll go ahead and get started here. I'm going to start today with a little bit of talking about why we see so much lameness this time of year. And actually, it might be more appropriate earlier in the fall, late summer, early fall. It seems to be a particular time when we tend to see more of the lameness. And I want to talk about why that might be. And also then why transition cows are particularly important. So there's kind of two things: the season of the year and then the time in the lactation of the cows. Most of it I'm going to cover there. So we think about the transition cows. There's lots of changes going on there. We have a pregnancy status change. The cow goes from being pregnant to not pregnant. And of course, that cascade is all started with hormonal changes. And a lot of those hormonal changes affect the whole cow, not just the reproductive part. And then, of course, we feed the cow differently. We go from feeding her a fairly low energy diet, usually in the far off pen, to maybe a little bit higher energy in the close up. And then she's expected to transition to a high cow ration eventually, maybe a fresh cow ration in the middle there. And the amount that she eats really changes a lot. A big Holstein will probably only eat 28, 30 pounds during her dry period, or at least the end of the dry period, and we expect her to eat about twice that within a few weeks afterwards. So a lot of those changes happen pretty quickly. And then, of course, there's pen moves and environmental changes. The far off pen and the close up pen frequently look different. They may or may not have free stalls in them, and we have more free stalls in the milk cows on average. And of course, they get used to new pen mates, and there's always a pecking order of stuff there. And then the time budget change is kind of a big one, because think about a dry cow needs to get up to eat and drink and lay down. She really doesn't have too much else to do till she calves, and then she suddenly has to be going to the parlor 2 or 3 times a day. And of course, we have all these metabolic changes and challenges that happen during this time. Just that most of the diseases cows get, they're just more likely to get at this time. Of course, the obvious ones there are retained placenta and metritis, because the calf just came out of the uterus. But also milk fever is more likely right then. That's almost when we see most all the cases. And we just tend to see more problems and challenges right there around calving. So I want to cover here one of the reasons that is. And there's a hormone that's released by the cow. It's actually very closely related to insulin. It's called relaxin, but it doesn't do the same thing insulin does. It actually works on the connective tissue. And you think about the cow getting ready to have her calf, she needs to get the tissues in the pelvis loosened up so that the calf can come through there and things can dilate well. But unfortunately, that relaxin doesn't work just on the tissues we want it to work on in the pelvis. It works on the bones and the joints throughout the body. And one of those is down here in the foot. And my colleague Ann Jablinski did the picture here. You see the papillae there in the hoof wall. and then the that's a really strong suspension there that keeps that P3 up. That's it's actually the tip of the toe. And Dr. Shearer is going to show this in a little more detail when he talks. And then, of course, there's other hormones that happen there too. There's estrogen that forms that makes changes the synthesis of collagen and might increase fibrosis. So there's quite a few changes that are going on there. All right, so here's just a close-up of the relaxin working. The lamina there in the front where the suspension happens, that's released by disrupted with increased relaxin. And I really like the name of that hormone, relaxin, because it just kind of tells you what's going to be happening. The pelvis is going to be relaxing, but unfortunately the rest of the joints relax. One of the ways that happens is through this enzyme called MMP, matrix metalloproteinase. And that unfortunately leads to some loss integrity to that P3 bone, and it can rotate down. And again, Dr. Shearer is going to show us in a little more detail of why that happens. And so I'm going to talk about why some of these things might be a problem with any cow, but especially the close-up in the fresh. One is heat stress. So heat stress is a real problem because the cows stand too long and their feed intake fluctuates. There's all sorts of things there that go wrong when a cow gets in their heat stress. Fly pressure, because especially the stable flies. I'm going to show a picture here in a second of that happening. It makes the cows bunch. They don't rest and relax like they need to, and it just leads to issues. And of course, overcrowding, and I think especially in the close-ups and the fresh cows, I have a rule of thumb that there shouldn't be more than 80% stocking in those pens, maybe up to 90% during the worst time when the slugs come in. But if we get up above 100, we start to end up having more problems. I do think it's fine to overcrowd some of the other pens as long as we keep feed in front of them and have the stalls well maintained and everything. But the close-ups and the fresh, we can't do that with. And of course, bed and maintenance. If the beds are nice and full, the cows will lay down. If they don't have enough sand or dry manure, whatever reason for the bedding, they just won't feel as comfortable and won't necessarily lay down as much as they should be. And because of that, elastin coming in there, it makes it but that much more important during the time of calving to not have these issues happening then. So here's just some pictures with the acidosis. Those cows to the left are open mouth breathing and they're standing there. When a cow has a hard time breathing and moving enough air, she just won't lay down because it's difficult to breathe when you're really hot and need to pant if you're laying down. So they stand, and when they stand too long, especially with the relaxin on board and all the other problems happening around calving, that can lead to a lot of problems. And that cow to the right there is actually perching. If you notice, her front legs are in the stall and her back legs are out, and that puts more pressure on those back legs, and that's where we end up seeing a lot of the lamenesses in the back legs for several reasons, not just because they perch like this, but again, Jan's going to show us some of that. All right, this is a cow cooling picture, effect on milk production, and so this not directly related to lameness in this issue, but I want to make the point that this work out of Florida was really some neat studies that were done to show that when cows are cooled, they give more milk that lactation. And that's not a big surprise to us. We know that the cow gets off to a good start. But what's interesting is even her calf, when that calf becomes an adult, will give more milk if the cow was cooled during the time when she was dry, when that calf was in utero. So it's more important than we might ever think to cool the close-up cows. And then they did some more research, because the original research they did on that was looking at just the close-up, and they showed that really it's the whole dry period when cows need to be cooled to get that positive effect. And I got a picture here of some fly pressure. These are stable flies. So this picture to the left. Sure, is there a question? Nope. The picture to the left there shows where these stable flies land on the cow. They land on the legs, and they're always facing straight up. And when they bite, it's a very painful bite. I've been bit a few times by them, and I don't wish that on any cow or human ever. And so what the cows do to avoid that is they'll bunch together, and that way the cows on the outside are getting bit, but the ones on the inside aren't. And that behavior, though, makes it so those cows are not laying down and relaxing. So I think it's really important to control these flies and make it so they lay down, so the cows will lay down during that time of day. The picture here to the middle is a freestall here in Iowa. You notice how the cows are way down at the end. And the one to the right is actually an open lot in California. And notice how those cows are all in the middle of the lot instead of laying down and relaxing. All right, and the third thing I want to bring up is body condition. Studies have shown that when cows get really thin, this digital cushion on the cow decreases and makes it so she doesn't have as much padding for all the things in that foot to work right. And so that pad is really important. And so that's one of the places the weight is lost, is in that pad. And so it's really important to keep the body condition of it. Too much body condition is also bad. And when you think about that, because the cow gets really heavy, it puts more weight on all the joints. So unfortunately, I'm getting a little bit older, and I have a bad hip now. And I notice that when I get overweight, it's like carrying an extra gallon of milk around all day. It affects it. So it's important to keep these cows right in the right weight, not too much, not too fat, and not too skinny. I think 3 to 3.5 is about where we want to be. But we want to be careful to not gain too much weight in the dry period or lose weight in the dry period too. So really a lot of this, to get this ideal body condition score, has to happen during the lactation period, not during the dry period. We have a hard time fixing it once the cows are dried off, either too thin or too fat. All right, now I'm going to pass it over to Dr. Shearer.
Dr. Jan Shearer is a graduate of the Ohio State University College of Veterinary Medicine. He was a veterinary practitioner for approximately 5 years before returning to Ohio State to serve as assistant professor in preventative medicine. In 1982, he moved to the University of Florida, where he spent the majority of his career as a dairy extension veterinarian. He's currently dairy extension veterinary here at Iowa State University, where his interests are in lameness and welfare issues of dairy cattle.
Yeah, it's a pleasure to speak with you today. Thanks to Fred Hall, our extension specialist here at Iowa State, to help set this all up and make this whole thing possible. It's a pleasure to share this with Dr. Jardon, who's really done a nice job of setting up this entire discussion here, because many of the things he's discussed here are exactly the situation we have with respect to the lameness issue. One of the things I would just share, that a current understanding, at least of the lameness type folks, and that's possibly because maybe not many of us know enough about nutrition, maybe, but our current understanding generally indicates that errors in feeding and nutrition are not the primary causes of lameness, which is surprising to some, but is in fact, I think, true and makes sense when we look at this slide here. 90% of lameness is in the foot. 90% of that's in the foot involves the rear feet. Of that, roughly 70 to 90% involves the outer claw. So you see what I'm driving at here is that if nutrition was the predominant cause of lameness, all claws and all feet should be affected equally, but that's not the case, of course. And this has been true for a long, long time. Let me point out one of the reasons why that is, and this is some nice work by Nakembo and others on anatomic factors that are associated with this. The thing is that when you look at the cannon bone or the shin bone or the rear leg, let's say in this case, and we look at the length on its lateral or outer side, right? You notice that it is longer. You notice that line I have drawn across there. You see that although it's slight, the lateral side is longer as compared with the medial side. So what that does is that creates more weight bearing. If you look to the right there on that right hand slide, you see that you have a larger claw and you have one with a more stable weight bearing surface. It is also bearing more weight by virtue of this difference in the lengths on the medial versus lateral side of the cannon bone, but also because the inner claw you're looking at here on the right is less stable. And that less stable claw naturally rolls weight over to the outer claw, and because weight comes down through the center of the foot, it naturally rolls over to the outer claw. So this was recognized years ago by Tucson-Robin and is really the basis and the concepts behind the functional trimming methods that Tucson-Robin developed. So weight is transferred through the center of the lower limb into the foot, but that instability of the inner claw rolls over to the outer claw, and that contributes then to claw horn overgrowth and an imbalance in the weight bearing within these two claws, which over time becomes problematic. The next thing that I want to point out here are a couple of other anatomic factors that are relevant to lameness. One is if you look at the third phalanx, that's the P3 bone, that's the one that's encased within the horn shell itself. You find, as Bill pointed out, that this is this bone is suspended within the foghorn capsule. It's suspended by soft tissues all the way around. And so what's really interesting about this is how is the weight of this animal, when it puts its foot down, not able to push that P3 bone right straight down to the bottom and crush this sole that we're looking at here completely. Well, it's because of this very interesting suspensory apparatus, which I'm going to talk a little bit more about. It's an interdigitation of dermal and epidermal laminae that are composed, that dermal laminae are composed of a series of very strong collagen fiber bundles that are able to maintain that bone fixated or suspended. And then we have the support system down below, which is the connective tissue of the corium, as you see here. I have it identified here in the diagram here in the photograph. And then the digital cushion. Dr. Jardon mentioned here the shock absorber in the foot is located here. Both of those tissues then provide a support system for the bone. And then the other thing I want to point out here is the P3 bone, once again, just looking at it, you'll see that it is arch-shaped. It's arch-shaped, right? It's not flat, but it has kind of an arch shape to it. And on the back side of that, we have the flexor tuberosity. What is a tuberosity? A tuberosity is nothing more than a bump on a bone. But this flexor tuberosity is very important in the context of lameness. But let's look closer at the suspensory apparatus here of this third phalanx, P3 bone. These are the dermal laminae you're looking at here on the left. In the dermal laminae, you see those are consist of a series of very strong collagen fiber bundles. Those interdigitate with the epidermal laminae inside of this claw horn. And that's what then suspends this animal and suspends this P3 bone, I should say, within that claw horn capsule. Then you look on the right side, we get another view of that and a cross section where you have here in this yellow that you're looking at here, you'll see the yellow part there. That is that interdigitation. That's what that's meant to show there. That strong connection between the dermal laminae and the epidermal lamina. And so that is what creates this support system, along with these very strong dermal laminae that, as I said, consist of very strong collagen fiber bundles, which are able to suspend that bone up in the claw horn capsule. And then below, then you see, again, once again, the digital cushion and the corium that make up the supporting structures. Around the time of calving, is very important. As Dr. Jardon pointed out, you get this higher levels of relaxin and estrogen hormones that trigger in some way the release of proteinase enzymes that are very, very destructive. They break down these strong collagen fiber bundles within that suspensory apparatus we were just looking at. And as a result, this bone will sink then within the claw horn capsule. And that's where we get the problems to occur. So let's look at it here a second. We have this weakening of the suspensory apparatus that's caused by these hormonal changes and the enzyme breakdown of the collagen fiber bundles within the dermal laminae. You get the sinking of the P3 bone that we're looking at here, because when you break down those collagen fiber bundles, what happens is they become weakened and they essentially elongate or stretch, which allows them this P3 bone then to sink within the claw horn capsule. And that sinking within the claw horn capsule creates some real trauma to the tissues beneath. And so that's what happens with conditions where we run into a weakened state of the suspensory apparatus that can occur for a number of reasons. So let's look at it here. Again, this is the sinking of the P3 bone. As I pointed out, this P3 bone is arch-shaped. If you can see in this photograph, you can see here that at the toe and back here at the heel, where the flexor tuberosity is where the primary pinching of the corium occurs. And so naturally, that's going to cause problems, and it does. And these two zones right here that I have demarcated here with a red spot is where ulcers in the sole or ulcers in the toe are likely to occur. And that's the manifestation, and that's what those look like. That's a sole ulcer from that backside of the P3 bone pinching down on that corium from behind there at the site of the flexor tuberosity. And then you have the toe ulcer here in the front, right? Normally cattle will sink a little bit more toward the rear than they will toward the front, simply because of the suspensory system within this claw horn capsule. So we tend to see more of the sole ulcers than the toe ulcer situation in most cases. And then another one, the size of the digital cushion. This is the cow's shock absorber. This is the cow's claw's shock absorber, I should say. And we know from work that's been done a variety of places around the world now that we find that this is related to body condition. Smaller digital cushions are less protective to the claw. In other words, less protective to those lesions that I just showed you a moment ago there. And what we also know is that that instead of what we used to think was that because cows got lame, they would get thin. Now we understand that thin cows become lame. And the reason is because this thin, this weakened, here's a good, strong digital cushion, but over here on the far right, we're looking at a digital cushion that's very small, and that just doesn't cushion as well. So as a result, much more likely to develop these kinds of conditions, and particularly during the early lactation period, when the cow may be mobilizing lipids, in the early lactation period is associated with negative energy balance and so forth. So that's when some of this most likely occurs. Then the other thing, one of the last things I want to share with you here is this, the effects of prolonged standing. We know that prolonged standing is an important contributor to claw conditions, in particular sole ulcers. So when we look at this thing, what we understand is that the solar corium is exposed to very high local mechanical pressure, particularly when cows are standing for excessively long periods. And it's been known for quite some time now that this has some real negatives. And in particular, we look at the solar corium and connective tissue and the living layers of the epidermis, and in particular, the germinal epithelium. So what I want you to do here with me is look at this section we're taking out of. We're going to take a rectangular box there I'm looking at. I want you to look at that. We're going to cut that out and we blow that up right here on the right. And then we're going to look specifically at this reddened band right here. That's where that epidermal junction we looked at earlier is, and that's also where the germinal epithelium is, where we find this pressure creating tremendous problems for this animal in terms of a healthy foot. Maybe we can see it a little easier here. When we look at the corium, which is in this right side here, this is the corium up above here. The corium sends nutrients down across this basement membrane here, okay, and into the basal cell layer and into the stratum spinosum layers of developing horn cells, right? Those are all live cells, and they are alive solely from the diffusion of nutrients across the basement membrane, right? Because they receive no direct blood supply. And as these cells gradually migrate further out away from this germinal epithelium, which is the stratum spinosum and basal cell layer, as they migrate further out, they gradually get so far out that they are beyond the point at which they receive this nutrients by diffusion, and then they begin to die. And when they begin to die, they cornify, or in other words, become horn-like. And so that is how horn is formed. So what the problem is that we're talking about here is that there's tremendous pressure when cows are standing too long. There's tremendous pressure on this germinal epithelium where these living cells are trying to do their thing, which is to grow and become horn cells, mature horn cells. And so that's an important part of the discussion of why we're concerned about cows that stand too long. So is this new information? No, absolutely not. You see, we've known this for a long time, as you'll see here in just a second. But what I want you to also notice here, when I talked about that flexor tuberosity there previously on the backside of P3, this chronic pressure, this chronic problems with lameness, maybe several bouts of sole ulcers, that inflammation creates this new horn formation on the bone, as we're looking at here in the photo on the right here that I have circled. And where we have that, whenever that happens, you see, of course, as that builds up and that builds up, that then increases the likelihood of sole ulcers to occur. Now, as I said, Is this new information? No. How many have ever heard of the Rusterholz ulcer? Anton Rusterholz in 1920 established a causal link with hard flooring surfaces, and he determined and noticed way back then that hard flooring surfaces would cause the development of these new bone formations on P3, particularly at the flexor tuberosity site. And that, you see, is what became an important cause of lameness in cows as they continue to grow older. And so, in summary, quickly, errors in feeding and nutrition can be, but rarely seem to be, the cause of claw-radiated lameness in dairy cattle, certainly in many of our large systems today. If we manage our nutritional programs right, then we have to make sure that we're managing cow comfort right, as Dr. Jardon has described here. And we know that the lateral claw is the one that is predisposed to greater weight bearing. It's also the one, for the reasons we've been discussing here, the one more likely to develop a problem. Those anatomical features that I presented there are likely to predispose to lameness for a variety of reasons. One, around this transition period, there's a potential for the weakening of the suspensory apparatus by those hormonal changes and the enzyme activity breaks down those strong collagen fiber bundles of the dermal laminate. Then you have the sinking of P3, which is followed by the toe and the sole ulcers. We have lipid mobilizations, which reduces the digital cushion size. And so that becomes a factor then as well, certainly for cows in early lactation and sometimes well beyond that, whenever that thin cow state occurs and they have these very small or less protective digital cushions. So thin cows have smaller digital cushions and they have a greater possibility of becoming lame. And then the excess standing time. We know that when cows stand too long, they're going to have more claw disorders. And ulcers tend to be one of the most important. And the work of Anton Rusterholz many years ago, it's been 100 years since that. But Anton Rusterholz understood it back then. Sometimes the problem for us is just, the ability to rediscover some of these things. And we have rediscovered that Anton Rusterholz had it right over 100 years ago when he understood that hard flooring surfaces caused lameness because of the factors we've talked about. I'll close right there. I hope this has been somewhat useful to you, but let me turn back over to you, Fred.
So again, thank you very much, and we'll look forward to seeing our attendees next month when we have a review of what we're seeing, the corn silage being analyzed from this trial. Again, thank you very much.